November is Lung Cancer Awareness Month. It's the leading cause of cancer-related deaths in the U.S., but certainly a disease that deserves attention all year, since nearly 227,000 people will be diagnosed this year alone. Dr. Ghulam Abbas with UT Health East Texas is joining us now to talk more about lung health. Dr. Abbas, a recent report finds that there's significant progress against lung cancer. What's leading to those strides?
The things which is causing significant impact on lung cancer mortality or death related caused by lung cancer, it is lung cancer screening. No such single treatment will decrease the mortality of lung cancer by 25 or 26% as the simple lung cancer screening CT scan does. So we have identified high-risk patients who are high risk for developing lung cancer. And we have shown if we do low-dose CT scan every year in these patients, the chances of dying from lung cancer decreases by 25%.
So who should be getting screened for lung cancer?
Anybody who has been smoking for more than 20 years, 1 pack a day, or for 10 years for 2 packs a day, and has not quit smoking in last 15 years should get a lung cancer screening.
Now, what about people that may have lung cancer that runs in their family? Should they also be getting screened?
There's no such indications or criteria or guidelines right now, but patients who have family history of lung cancer, they have increased risk developing lung cancer because they probably live in the same environment. Like smoking is one of the reason you will see causing lung cancer, but radon is the second most common cause.
I know lung cancer screening rates vary also from state to state. How are we doing here in Texas for that?
Texas is still low, but nationally is not as bad. Like I was in West Virginia where the lung cancer screening was just happening in 6% of eligible patients, and Texas is close to 18%, but it's still only 18% of patients who are eligible for lung cancer.
Well, you talked about screening being the most important part, but are there any lung cancer treatments that are helping patients live longer?
Sure. Yeah, so I think there's 2 things which I will elaborate on. One is the current surge with immunotherapy. The immunotherapy in combination with chemotherapy has shown significant improvement in survival. The immunotherapy also plus the targeted therapy. And the second thing is the surgical technique. We used to remove the entire lobe. Now we do lung preserving surgery using the robotic. And UT Tyler is one of the center of excellence for robotic lung cancer surgery, where we're using the robot with the modern technology and removing only a segment of the lung where the lung cancer is. And the survival is same if you do a lung preserving surgery or you remove the entire lobe.
Well, before we go, let's talk about prevention and what we can do now to hopefully stop lung cancer before it ever starts.
Yeah, so the most important thing is smoking cessation. The combination of a smoking cessation and lung cancer screening, that will have the most significant impact on the survival.
Well, thank you so much for taking time and being with us today and helping educate East Texans on how we could possibly save a life here. Thank you so much.
Thank you very much for having me.